Welcome, everyone, and thank you for taking the time to join us at our webinar about food allergy labeling in restaurants. And thank you to our 5 panelists who will be joining us later. My name is Mendez. I'm president and CEO of the Asthma and Allergy Foundation of America, which includes our division, Kids with Food Allergies. Our acronyms are AAFA and KFA. We're the oldest and largest patient advocacy organization dedicated to the asthma and allergy community in the world. If you go to the next slide, my colleagues you'll see here, Jenna Riemenschneider and Alexa Jordan, will be running this webinar. But before I turn it over to them, I'd like to say a few things about my commitment to this topic and to my role at AAFA as CEO. I have a strong connection to the food allergy community based on my own family's experience with food allergies. In addition to 2 of my 3 sons having had food allergies, my sister's kids, two of her kids, have also had food allergies. Now they're in their 30s now, but there's never a family gathering that goes by where we don't end up talking about banter on food allergies and what it's like to live with food allergies. And in fact, I hear to this day about when they're in restaurants and going out about accidental exposure to allergens, as even in their 30s, they're going out to eat. And so it's really important to us. And I remember when they were children, how difficult it was to navigate the landscape living with food allergies. So this is personal for me, and that's one of the reasons why I joined AAFA. When I started at AAFA, we added a vision and core values to what we already had in a mission statement. And that vision is to be recognized as the trusted ally serving the asthma and allergy community. And we've got 6 core values. One of them is trust. And I think you'll see that trust permeates everything that we do as an organization. So for our community, trust is paramount, especially if you have food allergies, whether you're in a restaurant or you're at a friend's house or with your family. So with that, I'll turn it over to Jenna to carry you through the rest of this. Jenna?
Thanks, Kenny. And thank you all for being here today. So before I get to the agenda, I do want to briefly go over some logistics. By default, everyone is muted and off camera to help with streaming, but we encourage you to send messages in the chat. This meeting is being recorded and the video will be available on our AAFA and KFA YouTube channels within the next few days. And of course, you can reach out to us directly. We're going to share some contact info at the end of the presentation, and our doors are open. So now that I've covered that, onto the agenda. Today, we're going to review the current reality of dining out with food allergies and the impact on individuals and families who are navigating allergen-restricted diets. We'll walk through AAFA's goal to improve food allergen labeling on menus and do a deep dive into California's ADDE Act. We're also honored to have some dedicated food allergy advocates joining us as panelists. And lastly, we'll walk you through how you can take action to help improve allergen disclosures for restaurant food. So if you or a loved one have food allergies, you probably know just how challenging it is to find safe foods that are not prepackaged with food labels that identify allergens. We at AAFA think it's helpful to quantify just how difficult this situation can be for consumers, so we decided to do the research. AAFA conducts different types of research to solicit feedback from our food allergy community and gain insights into the challenges and burdens families are facing. One of the research studies we conducted was a parent and teen survey to capture what life is like living with food allergies. And it, of course, included a line of questions about dining out. So according to this research, parents who took the survey, 3 out of 4 of them reported that dining out is challenging. Probably no surprise there. Additionally, over half of parents managing food allergies reported having to leave a restaurant in the middle of dining. And I'd be curious if you all wanted to share in the chat if you have also had this experience. And finally, from our report, a staggering 9 out of 10 families report avoiding certain restaurants. So we're not the only ones doing research on this. Other research that addresses the health outcomes related to dining out with food allergies include this study published in Frontiers in Allergies, which found that up to 1 out of every 4 serious allergic reactions, so about 25%, are triggered by foods happen by foods while dining out. So it really doesn't help to instill confidence in families trying to navigate finding safe foods to eat. And perhaps most concerning is this information from the CDC's Morbidity and Mortality Weekly Report in 2017. It linked nearly half of food allergy-related deaths to food from a restaurant or other food service provider. Now, it is important to remind everyone that deaths from food allergy are rare. It's around 150 per year, but it doesn't make it any less tragic. Even one death is one too many because this is preventable. So the best way to prevent food allergy reactions is to avoid eating the foods that trigger the reaction. But in order to avoid those allergens, people need clear, transparent labeling. Now, the good news is since 2005, the Food Allergen Labeling Consumer Protection Act, also known as FALCPA, has been enacted. This is the law of the land, and it requires FDA to regulate prepackaged food to clearly identify major allergens. Unfortunately, this law does not cover restaurants or other made-to-order foods. But other countries have adopted menu allergen labeling. In fact, since 2014, European countries have required food establishments to provide clear information about 14 allergens. This regulation, known as the Food Information to Consumers Regulation, or FIC, applies across the EU and has been mirrored by neighboring nations like Switzerland, Norway, and the UK. It marks a major step forward in protecting people with food allergies by making allergen information accessible for non-prepackaged food served in restaurants. And while implementation varies slightly by country, the core requirement is the same. Consumers must be able to make informed choices about their food. Now, did it work? Yes. But different European countries did have different success rates on the implementation of the FIC regulation. Fortunately, they have done a report to see how successful. So a 2020 report assessed the food industry's implementation and provision of food allergen information for consumers. The UK, for example, has reported high compliance to FIC, with nearly all food businesses having an allergen labeling policy in place. This is a 60% increase since before the regulation was put in place. Additionally, 83% of UK food businesses offer written allergen labelings, while there's another 95% that have coverage of food allergen labeling when there includes the use of both written and verbal disclosures. The industry survey also asked European food businesses under FIC regulation if they had challenges implementing the new policies under the 2014 legislation. And although more than half of all businesses reported no issues implementing at all, some concerns did arise. The most common challenge reported was remembering to update the information. And notably, this did outrank staff training, the time it takes to update, and ensuring suppliers provide the correct info. And now we're on to a bit of show and tell. Kenny was recently traveling in Europe to support our household product certification program and had the opportunity to scope out some menus and food allergy policies. Kenny, can you walk us through your experiences and compare it to dining out in the United States?
Sure. Thanks, Jenna. So first off, everyone should know there are 14 allergens that must be labeled in Europe. And this is a picture of me with a restaurant manager of a restaurant in France. And he was emphatic, speaking in French, on how important allergen labeling is to him and the potentially fatal consequences for people with food allergies. So we bonded over that. And he said if they don't know what's in their food they're ordering, it could be fatal. And I'm holding up the special allergy menu that he provides for people who request one. And if you see the next slide, this is another different menu from France. And you'll see on the bottom right-hand corner, there's a QR code that you can scan. And if you look at the next slide, when you scan the code, a PDF pops up with the menu items. On the left-hand side, you'll see the menu items, and across the top are the 14 allergens, and then each of the allergens is flagged alongside the menu item. This was a fun project for my wife and me, since we don't have the benefit of this in America, and it was really interesting to see how helpful it was, and we wished we had it when our kids were younger, and even for our adult children right now. If you go to the next slide, this is a McDonald's, and you'll see me pointing at where they post their food allergens on the outside of the restaurant before you go in to actually order off an electronic menu when you place your order. The next slide is one from Spain, and you'll see the icons at the bottom for the 14 allergens, and you can ask them for the menu, and those icons will be next to them. And then the final slide here is a menu from Ireland, where I found that they're probably the most friendly. And you'll see at the bottom of this menu item, there are the 14 allergens, and they're coded along with subcodes for them. And then you'll see on each of the line items above, they code which allergens are in that specific menu. Now, what's interesting about this was I was holding a piece of paper that could have been printed from a household laser printer. So it was quite easy for them to produce this, and if the menu changed, they could reproduce another one. So that was really my experience in Europe, and feel like we're not far from that. If it's happening successfully there, that we could certainly do this in California. Jenna, back to you.
Thanks, Kenny. I think that perfectly illustrates, what is possible. And with all of this in mind, I just really want to reiterate that it is our goal to improve food allergen labeling on menus. We want families to feel confident when they are assessing food choices, and we want families to have information. So AAFA's Food Allergy Division, Kids with Food Allergy, or KFA, hosts the largest online community for food allergies, and our mission is to save lives and reduce the burden of disease on people with asthma and allergies. And this includes the challenges families face when trying to find safe foods. Two of our organization's top values, as Kenny mentioned earlier, are trust and being patient-centered. This means listening to and acting on behalf of our community. We use the feedback from the community to guide our public policy and advocacy priorities. For example, our insights from that My Life with Food Allergy surveys, and then we also hear personal stories shared with us in the community. We have our own lived experiences as well. Many of our staff live with and manage food allergies and other allergic conditions. Our current food allergy advocacy priorities, again, stemming from all of this feedback that we receive from the community, includes affordable access to healthcare and treatments, protecting food allergy accommodations in schools, and improving food allergen labels. We're currently leading a collaborative effort to improve precautionary allergen warnings on packaged foods, as well as requiring allergen disclosures on alcoholic beverages. Today's focus is on allergen labels for restaurant food, And this issue is so important to our community that it's a high priority actually in AAFA's strategic plan. So now it's my pleasure to introduce you to Alexa Jordan, AAFA's Policy and Advocacy Coordinator, who has been leading our work on this, starting in California.
Thanks, Jenna. Now, we have made some really exciting progress in California on Senate Bill 68, also known as the ADDE Act. So the allergen disclosure for dining experiences, or ADDE, you might hear us refer to as ADDE Act. The ADDE Act is inspired by 9-year-old Addie Lau, whose mom is here on the call. Hi, Robin. She and her mom, Robin, are co-sponsors of ADDE, and they brought and started working up this amazing idea back last summer in 2024. So they've been working on this for quite a bit of time. California State Senator Caroline Menjivar, actually the Senate Health Committee chairwoman, introduced this piece of legislation back in January. She has several food allergies herself, and in her testimony, which we'll talk about in just a minute, she shared about different times when she actually had anaphylactic reactions to unlabeled restaurant food. And as someone with a food allergy myself, this really, really hits home. So AAFA is actually a co-sponsor of California's legislation, SB 68. And what exactly this bill does is it is the first state law in the US that would make it mandatory for restaurants to provide allergen information in written form on menus or menu boards. And what does it mean to be a co-sponsor? It means that we're helping the senator and Robin to convene a number of national and state organizations that want to, contribute to this effort and to say that this is a law that we really need. So the two, again, things that this bill, the ADDE Act, would do, the first one is it actually adds sesame to the list of major allergens for California's retail food code. And the second thing is that it requires a written notification on restaurant menus of the 9 major food allergens. And this, we get some questions about this. So what does it mean to have restaurant food? It's any food establishment that serves or sells restaurant type food. And that's, the very specific subset of what this bill focuses on. So we are, standing on the shoulders of giants on this SB 68 effort. California's retail food code actually already requires restaurants to know about food allergy training and ensure safe food handling practices. So some of the existing law requires that the person actually in charge of every restaurant or food facility in California understand the basics of food allergies. And this includes knowing what the major food allergens are and recognizing the symptoms of a serious allergic reaction. Staff has to be trained and educated about food allergies. And anyone who handles food already has to take a food safety training course and pass a test, and because we have all of this existing legislation in California, that's why we think SB 68 will be successful in California. We have seen an overwhelming groundswell of support for SB 68. So in addition to all of the organizations and restaurants that you see on this website or on this page right here, we have over 500 medical professionals who signed on to a joint letter to the Health Committee in the Senate. And we have nearly 44,000 individuals who signed a petition started by Marcus Medley that urges the legislature to actually pass better dining protections for those with food allergies. And we are getting new supporters every single day. I also want to introduce you to the California legislative process. So Addie's 3rd grade class came to the Capitol to speak with legislators about the importance of the bill, and the students attended a press conference and heard directly from the senator. And that was right before we actually went on to the hearing. Next slide, perfect. All right, so both ADDE and AAFA, we testified at the California Senate Health Committee meeting on April 9th, and luckily enough, it passed unanimously. So 11-0, absolutely fantastic results. Dozens of food allergy advocates actually added their testimonies in favor of the bill. They went up one by one to add their voice. And you can actually check out our blog on KFA's website where we have a link to the Senate hearing. It is absolutely powerful. Our Senate sponsor discusses how people still come up to them after this hearing, and just want to thank them and congratulate them on such a moving and touching hearing, because ADDE's class, one by one, went up to the microphone and urged to keep ADDE safe. So one of the amazing quotes that ADDE had in the recent Senate hearing is she said, "How can I know what's in my food? At a store, I can check the label on the food to see if it has my allergen. It's easy. At a restaurant, it's hidden, like a secret." This life-saving information should not be a secret, and that's why here at AAFA, we are so passionate about SB 68. We've also had quite a bit of media coverage of the ADDE Act. We have some TV pieces, ABC 10, the San Francisco Chronicle, Eater SF, but we still need your help to spread the word. We've been working to pitch additional media coverage of the bill. So if you have a local outlet or a national outlet that you have contacts with, of course, we'd love for you to spread the word about this great new bill that would revolutionize a lot of families with food allergies, their experience in dining out. So California legislative process, another key thing to know about is there's amendments that we can always work together to make the bill better. And AAFA has worked alongside Senator Mendez to evaluate potential improvements to the bill, but Senator Mendez has an open door policy and wants to discuss all amendments and ideas that stakeholders might have. And new amendments that the senator proposes, outside stakeholder proposes, and we all work together on them, we then can submit those to the Appropriations Committee and then have them incorporate that into the bill. So whatever was passed in the Senate Health Committee doesn't mean that's the end of where necessarily the bill is going to be. So by May 22nd, that's when we know if it will move out of the Appropriations Committee. And the Appropriations Committee, and it's kind of a strange process, but they basically have to figure out how much money it's going to cost the state, right? So what are the costs associated with the bill? Some examples, some of the factors it includes, right? The time, the routine health inspectors have to spend additionally trying to make sure that all the different restaurants are compliant with the law. And also, there's some other administerial staff time that's going to be incurred, including the creation of guidance documents for restaurants to follow. So these are some of the costs that the Appropriations Committee is going to have to decide on. And by May 22nd, we'll know if it's moving on to the next step. So that next step would be to the Senate floor. So really quickly here, I just going to walk you through the timeline. So January, that's when the bill was introduced. Then it moved on to the Health Committee hearing. That's when AAFA and ADDE went to go testify, and her class got to talk to senators. And then May 12th, we're actually having a appropriations lobby day. So this is our California Day of Action. So for all of you 100 plus individuals on the call, if you live in California, we need your help. And so I will drop a link in the chat after I'm done, just to make sure that you have seen the opportunity to actually get to talk with your representatives, both senators and assembly members, to just remind them of why this bill would be so impactful for you. And then on, again, May 22nd, that's the appropriations deadline. So we know if bills are moving out of appropriations. And then it moves to the Senate floor. It's a quick process. The senators will vote. And if it passes the Senate, then we do it all over again, starting on the Assembly side. So the same way we did the Health Committee hearing for the Senate, we'll have an Assembly Health Policy Committee hearing, and then there's going to be a little break for summer recess, and then there's Assembly appropriations, just like we did for the Senate. Then it goes to the Assembly floor, and then it moves to the governor. So we are still at the beginning of this process, but we are very hopeful by seeing the momentum, not only at the hearing, on our joint sign-in letter, by actually talking with the senators themselves and hearing that they say, why is this not already in place? Is this all we're asking for? And it's like, yes, it would totally change our lives. So thank you for considering it, senators, right? Let's see. Yeah, so what's next for ADDE? What's next for ADDE? So if you live in California, again, we really want you to sign up and meet with your legislator virtually and or in person, and we can help coordinate that for you. The day of action that we have designated is May 12th. But if you don't live in California, we know there are many eager people and advocates who want to help. And I personally don't live in California and I get to work for AAFA, which is great. So how can you engage with AAFA, right? Well, this is how you can. You can sign up to be a part of our grassroots group, Advocates for SB 68. And I will send you a list of restaurants. I'll send you a one-pager. You can reach out to local community restaurants, and maybe even this can inspire you to bring this type of legislation to your state legislature in future sessions. So with that, I'm going to turn the time back over to Jenna, who will be moderating our amazing advocates, starting with Robin.
Thanks, Alexa, and thanks for that very well done overview. So I think we know the most powerful voices are the voices of advocates, and we're excited to have several advocates here today to talk about grassroots advocacy and how our community can work together to improve public policies. First up, I'd like to introduce Robin Lau, who is also the co-sponsor of ADDE's Act. Robin is ADDE's mom, who also works as a nurse, and she began advocating for SB 68 last June. So Robin, your perspective as a mom managing food allergies, but also as a healthcare professional, has been instrumental to move this forward. What made you decide to focus your advocacy efforts on menu labeling?
Yeah, thank you so much. So I'm a pediatric nurse practitioner. I actually practice in surgery, but I do have a background in critical care in pediatrics and in trauma surgery. And so definitely from my medical experience, I've definitely have seen unfortunate events happen to children, some of it that could have been avoidable. And so as a nurse, I'm always really thinking about preventative care. What can we do to prevent these terrible outcomes? And when I'm talking to patients, it's always about educating them of how to prevent things, how to stay safe, how to stay healthy. And so when I had Addie, we learned early on when she was a baby that she had food allergies. And as a mom, how can I protect her in the world, right? And so, in healthcare, we're always looking also at safety from a standpoint of preventing medical mistakes, right? Just like aviation safety. And so really when I looked at labeling, I felt like this was really the gold standard. If we can check packaged foods, we have nothing to check in the restaurant, right? How do we know what's in the ingredients? It's all verbal communication, which often leaves us feeling really unsure. And so I felt like this was really needed to move that needle forward.
Awesome. What has it been like to watch your 9-year-old powerhouse testify to the California legislature and rally support of so many people?
Yeah, it's been truly amazing. She started being interested in allergy advocacy last year. So she's in 3rd grade now. She just turned 9. And she started with a school assembly last May for allergy awareness. And I was just so proud of her. I wasn't sure that she would want to do this, but she was like, oh yeah, for sure. I want to, educate my friends, educate the school. She stood up before the entire school that were all on the blacktop and taught them about how she uses her EpiPen, about allergies, and kind of quizzed them and made it really fun. And that was through Red Sneakers for Oakley. And so this really became kind of the next step. It was actually her thought of, no, I want to go to the Capitol. Let's do something. And so seeing her now advocate for herself, I think that's the goal of a lot of food allergy parents, right? Making sure that our children, as they grow up, they're able to advocate for themselves, tell people about their allergies, make sure things are safe. And so, I'm just so proud of how far this has come. And with public speaking, you wouldn't have known, but she actually had a stutter growing up and was in speech therapy. And so it's just amazing how far she's come.
You would not have known that. She's brought me to tears on multiple occasions watching her testimony. You've secured nearly 1,000 signatures on a joint letter to the Health Committee and the support of over 500 medical professionals across California. Can you share with us how you've been able to build that support on an issue that is so important to our community, but has low awareness among the general public?
Yeah, so I'm a nurse practitioner and my husband is a physician. And so luckily enough, we had some connections just through our own work. We used to work in San Francisco at UCSF. And so really leaned on some of those connections we had. So basically just started going down our contacts list and started texting people. But also, you know, at our hospitals, we started posting flyers, getting the word out to our nursing staff, physician teams, and through our professional organizations as well. I'm part of a national nurse practitioner group called NAPNAP. It's National Association of Pediatric Nurse Practitioners. And so I'm the current legislative chair of the Sacramento chapter. And we have a collaborative throughout California. So chapters throughout California, which actually have helped where they then spread to their connections. So it's been really helpful. I think a lot of people, when I tell them about this, they were like, oh my gosh, of course, this makes sense, you know. And so they're happy to kind of spread that along, and that's how we built all this signatures. Definitely also using social media, Facebook groups, things like that.
Yeah, all the tools in the toolbox. Well, I have to say it's been really incredible to watch and support. And I know we have, you know, as the legislative timeline indicated, we have more work to do, but I'm confident that, you know, we can work together to get it done. And with that, I will turn to another grassroots champion. It's my pleasure to introduce Thomas Silvera, co-founder of the Elijah-Alavi Foundation. Now, AAFA first partnered with the Elijah-Alavi Foundation in 2019 to support Elijah's Echo, rallying over 500 advocates in New York to help get the first version of Elijah's Law signed into law in New York. The law requires child care facilities to have policies in place to prevent, recognize, and respond to food allergy emergencies in a child care setting. And together, we published the Child Care Policies for Food Allergy Elijah's Law report, which this report reviews food allergy protections in all 50 states and provides a roadmap for advocates and lawmakers to adopt stronger safety policies in child care settings. So far, it's passed in 6 states and 1 city, and you know the road ahead is looking good. We continue to support the Elijah-Alavi Foundation in support of Elijah's Law. You know, Thomas, you're going to have to correct me if I'm wrong, but we have currently the prospects are looking good in Missouri, Pennsylvania, Texas, Minnesota, Michigan. But, you know, none of this would be possible without the leadership and tenacity of Thomas, Elijah's father. When we at AAFA think of someone who's successful at grassroots advocacy, we think of you and the Elijah-Alavi Foundation first. So Thomas, when you first had the idea to honor Elijah's memory and pursue this law in New York to protect other children, did you imagine it could be expanded to other states across the country and be successfully implemented in states with different political majorities?
We could not fathom this direction that we were going in. Originally, that, you know, when Dean and I first, you know, wanted to honor our son Elijah's memory, even in our grief, like we wanted to fight for change. And our first thought was like, we need to do the research in what's going on in New York City particularly, because we didn't know, I didn't understand legislation, neither did she, but we did the research. We found out there was nothing protecting children in childcare. So, you know, then we just got to thinking, and so we went to our local officials and everything, and we got to focus on this legislation. And our focus was on protecting children in our own backyard, you know, but the way the law worked, it allowed us to expand it throughout New York. It was one of the things we wanted to make sure that family would not have to endure what we went through as parents, and create a movement behind this, because what happened to our son, his passing was not in vain, and we wanted to put these added protections where it can resonate far beyond state lines. But to see it to go state by state and working with you on this from the very beginning is tremendous. And it's a testament to what the possibilities are when communities come together and unite on purpose and compassion, where we can keep pushing forward and join in and turn like something like this into a national movement for change. And it's always emotional when we go through this to see this, like even when we, it's always down to the wire when we get to the governor signing it, because we never know what could happen from there. It can be a great piece of legislation, but it's that final signature that enacts that law. So once that's enacted, it's a bittersweet moment, and it's an emotional for myself and for Dina and everyone who has joined us on this mission. So to see this go state by state, being the sixth state, and Kansas City also adopting this piece of legislation, and also Connecticut having components of Elijah's Law in the bill, it just says a lot about what community can do. And we're here not to pass a piece of legislation. Piece of legislation is to save lives.
And it absolutely will and has. It's obviously been my pleasure and honor to work with you over the years. And we have so much more work to do. So looking forward to that. But
Yeah,
in the
absolutely.
absence of federal laws addressing a policy, it is often the best course of action to pursue state laws. So what advice do you have for the food allergy community at large that could provide hope for ADDE's Act?
I can just start off saying I think the ADDE's Act is such an amazing piece of legislation that has been done, and I can't wait to see this move through and signed by the governor. But what I can say, when federal legislation, federal action stalls, like you have to go through state leadership to become essential. So the greatest advice I can give to the food allergy community as we advocate for ADDE's Act is that never underestimate the power of your local voice. Grassroots advocacy, story by story, state by state, can build an unstoppable momentum. Find your allies, tell your truth, and remember that every legislative victory, no matter how small, is a step towards protecting millions. Stay persistent, stay united, and know that the real change is possible, even when the path seems long, that I always think it is. Hope is not just an emotion, it's a strategy, and we can keep building from that and adding those protections to ADDE's Act. I think it's one of the things as grassroots organizations and working with so many organizations and people and advocates and everywhere, this is the momentum that is needed for the ADDEE Act. I think Robin and Addie did a tremendous job working with you and getting so many names and signatures on this bill. I'm just like taken back by it, and I love it because it's about unity. There's nothing that's divided. It's about what can we do to keep people protected and save lives. It's all about saving lives, and I think this is the advice I can give the community.
I hope we are recording this, thank goodness, because I needed to write all of that down. I love that hope is a strategy. So let's take that strategy and move it forward. Thomas, thank you so much. Always a pleasure to see you, chat with you. And I know we'll see each other soon because we have more states to hit
Yes,
for Elijah's Law.
Yeah. No,
So thank you.
Thank you.
Okay. So next, we welcome Toni Taylor and John Terry from Allergy Advocates New York, with whom we've collaborated over the years, and they're here to share some of their state-based success stories. So you have both been amazing forces in the New York State Legislature and have had remarkable success in the last legislative session with capping the price of epinephrine auto-injectors and stocking epinephrine in large venues in New York. Toni, will you tell us a little bit about how Allergy Advocates New York started and when?
We started first. Thank you so much for inviting us to this event. It's it is not often that we are in this position, so we appreciate the platform and your support. So how we started about 15 years ago, and John might have a better remembrance of the number, but John came to me at the time. I was living in New York City and I was working in a professional services consulting firm at the time, and he came to me as and I'll let John tell his sister's story, but he wanted to honor his sister and honor her life, and how could we do that? And so we started as just, I knew a little bit about building websites, I could do marketing and comms, and let's kind of just start with that. So we started very, very modestly. Then we kind of tried to find other like-minded folks in the community and in New York State to give us a sense of, we suffered a horrible loss. Let's let's get together to support each other through that loss. And what can we do to turn those losses into something positive? So then we met with two of our kind of rock star, amongst many. We got lots of rock star advocates, but the two that kind of helped us a lot in the beginning were Stacey Science and continue to be Stacey Science and Jill Midland, who is probably known to everybody on this call. So we were very lucky that they live in New York State. Yeah. So they kind of taught us the rules of the road. And my sense is what we were able to provide was just infrastructure around which we could gather advocates, give them kind of a convening space. So every year, our big thing is we do a big fly-in. Didn't know what the term was 3 years ago, until 3 years ago. We've been doing it for 10 years, but a fly-in into Albany in the month of May. And every year we bring a larger group of advocates, and we meet with more and more committee members, because the process in New York State is a lot more condensed. It's like, and the budget negotiations take up massive amounts of the legislative calendar. So that process is slightly different. So we have taken great comfort from being able to support the work of incredibly talented and dedicated group of New Yorkers. So John, what am I missing?
Well, first of all, Jenna, I want to give a shout out to the work that AAFA and KFA have done in so many aspects of helping families and individuals with life-threatening allergies. You guys have provided vital leadership in all these areas, and thank you for that, and thank you for having us here tonight. I think the main part of the whole creation of our organization was to try and provide more information that was accurate to as many people as possible. And as a part of that, we did concentrate on certain things that we did think would help in New York State directly with people that were our clients, so to speak. The individuals and families that had life-threatening allergies that were at risk for anaphylaxis. So one of the real big achievements for us was the Emergency Allergy Treatment Act. That act allows entities to obtain a non-patient specific prescription for epinephrine after taking a very simple training course. And as an extension of that, our association then will try to provide, if they're a nonprofit, to give a supporting funding for that, provided they're a nonprofit. So this legislation, when it passed, was passed and due to our efforts. And then once it was done, Toni took the lead in creating a training program that was state approved that we call the Emergency Allergy Treatment Act. And that has been, those seminars have been presented all across New York State, predominantly upstate, and has trained huge amounts of people in how to respond in anaphylaxis emergencies, how to administer an epinephrine autoinjector, the steps you take to save someone's life. And that bill is one that I am the proudest of. I think that looking back to last year, in my own personal view, the stocking of epinephrine bill for venues over 1,000, that is a big step forward. Hopefully, as time goes by and we move forward with this, we will soon see epinephrine auto-injectors and other emergency epinephrine devices on the walls right next to the automatic electronic defibrillators that are available in public places in case of heart attack. So yeah, those types of things, trying to directly aid people that are at risk, that's been our primary purpose.
Awesome. Well, thank you for that background. And Toni, you mentioned your lobby day, your day of action. From your observations, how does having these face-to-face conversations make an impact for the staffers and the representatives that you meet?
It basically, what this day does is that it allows, because we kind of set the day up with all the meetings ahead of time in front of the over the year, because we've got advocates who are, I mean, we're pretty well connected in Albany. We've got advocates who are also equally well, well connected in Albany. So so they will begin advocating and building sponsorship and finding sponsors for legislators before we even get to lobby day. And then by the time we get to Food Allergy Awareness Day, and the legislators, we've pretty much got sponsors on both chambers mostly lined up. And if we don't have sponsors lined up, that is our ask. It's like, okay, we need Senate sponsors or we need Assembly sponsors. And then in New York State, to my knowledge, we have never been asked to testify in a committee setting. However, all of our allergy advocates, if they've got one thing I love about working with kids managing their life-threatening allergies, they are the smartest kids I've ever worked with. It's like they are, you can point them in a direction and say, tell your story. And you can just watch legislators and their staffers melt into a puddle. And it's like, there you go. That's like, so, those stories are very, very powerful. And the fact that, so in our lobby day, you kind of come well rested and leave exhausted, because we have 4 teams of meetings going on. We've got a press conference. Meetings start usually about 10, they go to 5, and people either fall into a hotel room, the team dinner, or they drive home because they've got to go to school the next day. So it is a very intense day, but a very successful day. And it's also a lovely way to teach children, here's what democracy looks like. I mean, I remember the first time when Jill Midland said, yes, you can pull a member off the assembly floor and they'll come out and talk to you. It's like, oh, seriously? And it's like, it's the coolest thing in the world to do. So, to create that opportunity for families to do that and to speak directly to their legislators. A lot of folks don't get a chance to do that. So it's, I have a good time watching these kids learn how to do that. And we've been doing it a while, the fact, and we worked with Thomas as well, and we worked with Georgina Cornago, who I think is on this call also, and watching these kids grow up, it's a fascinating process. So
Awesome.
The thing that I've learned in terms of legislation, there are basic advocacy stuff that I have to remind myself all the time. Commitment, cooperation, and compromise. Commitment to continue to push along with what's important as long as it takes. Cooperation with other like-minded people and being willing to listen to their suggestions and to be patient and understanding what these other people are collaborating with. And most important, and I want to emphasize this, is compromise. Over and over again, compromise has been a vital part of us moving legislation ahead. It is my opinion, it's far better to take half a loaf than not to get any loaf at all. In the case of Stacey Science, she was the driving force behind the teacher training bill in legislation in New York State. And she worked on that bill for years, and it did not move at all with any significance. However, she did arrange a compromise that was instrumental in getting the law passed. And that type of action, of advocacy, that's critical to having any kind of forward movement and to help protect families at risk for anaphylaxis in every situation.
Awesome. Well, I think, thank you for that. I feel like that's a perfect segue, but I'm going to remember commitment, cooperation, and compromise. And I think that is a great takeaway. And now I would like to introduce Lianne Mandelbaum of No Nut Traveler. We're always grateful for Lianne's support, not only of the ADDE Act, but we've long aligned on other food allergy related advocacy, particularly stocking epinephrine on planes. As many of you may recall, Congress passed the FAA reauthorization last May, and the final bill did include the Duckworth-Fisher Amendment, which had anaphylaxis listed among the conditions that emergency medical kits on commercial airplanes must be equipped to treat. And it calls for review of these kits at least every 5 years. And while there is, a rulemaking process that will follow this, we consider it a success. So, Lianne, we worked together to get this done. Can you talk about the importance of building a coalition of support in order to achieve change?
Yes. It you can't just be alone in pushing an agenda. Everybody brings something different to the table. Everybody has a different set of skills. And also, I think you get more respect generated by those in the legislature when you have agreement. And I think that something that is often forgotten, not by anybody that is here necessarily, but that the disease is the enemy, right? So everybody here knows that. Everybody here wants to prevent a fatality, and they want to take steps to do that. And to do that, you really do need collaboration. You need all hands on decks, because this is a crisis, and food allergies have been growing globally, and we have to do things to elevate the voices of people with this condition. And that's why working in collaboration and this kind of webinar in itself is a window into just what collaboration can do, and bringing together different voices. And we all on this call have a different set of skills, and they're all valid, and they all help fight the disease.
They do. Now, you and your family travel a lot, and congratulations to your son. And you were able to effectively share your personal stories when you were advocating to improve air travel for people with food allergies. What recommendations do you have for advocates to help them effectively communicate with policymakers and other stakeholders?
Use your voice. Never think that because you are one person, one mother, one father, one young adult, or even an adult, that your voice is not important, because the surveys are important, the data is important. I'm always on that insofar as proving, that medically this is an issue that deserves attention, but it's the stories that really bring the statistics face to light. And just like Alexa was describing ADDE testifying in California, and people still coming up to the senator and saying how impactful it was, that's why. Because they remember her face, the face of her classmates. These are the kids that are going to restaurants that want to stay alive, just to put it bluntly. And, you also might think, that change is just so overwhelming and there's so much to do. But when you instruct your child how to read a menu, you are an advocate. When you share a story with me, one of my testimonials is what led to the DOT decision to put food allergy as a disability under the Air Carrier Access Act. So every story matters, every voice matters. Everything you do when you go to your child's school, and you find out where the epinephrine is and you have a plan, you're an advocate, and you're teaching the teachers, you're teaching the schools. When you're in a restaurant, you're teaching the staff there about allergies. You're teaching, you have a conversation with your restaurants. And I think those are really important in ways we can support ADDE. If there's a chain that has a branch in California, and you're living in New York or New Jersey or Connecticut or Massachusetts, and that chain is also in California, you can have a conversation with the manager of that chain, and maybe they'll be able to, you never know where something will lead to. And that's why I think, listen to everybody, include everybody. And again, what John said really hit home with me too, because I know how long Stacy worked on that bill, for 12 years. And then she did get it passed with compromise. And so compromise is important. And you can't look for perfect first time around. Right now, we have nothing. You go out to dinner in Europe, just like Kenny was giving. I traveled with, a lot of people probably know her as Miss Allergic Reactor. We were at a conference together, and she has multiple food allergies. And it was so easy to eat with her out of the country. It was seamless, and it should be seamless here. And I think that this is so important to fight for. And when we educate restaurants, we're educating people who come into restaurants. It leads to change in airlines. It leads to perhaps restaurants carrying the right medications one day. There's so much that just these little tiny steps that you might not be able to see that your tiny step matters, but it all matters. And all these tiny steps and all these tiny voices, they are a chorus that can, a tidal wave that can really affect change. So use your voice, share your story, whatever it has to do with allergies, and seek out collaborations with the organizations that represent you, like AAFA.
I was inspired before. I'm more inspired now. I love this idea of tiny steps. That to me is state-based advocacy. We're going to take lots of tiny steps and we're going to make real change. So thank you, Lianne.
We're not going to see them as tiny. And one more plug, I met Alexa because she had a bad airline story. And
Yeah.
look where she is now, like leading the charge, helping everybody else that's living with this condition. And that's what we need to do. We need to elevate the voices of the patient and have more of you and Alexa and other people, leading the charge.
Yes, we are here to raise the voices that, I think we very confidently feel that is our role, and we, want to continue to do that. So thank you, Lianne. Always a pleasure. So next up, Eleanor Garrow of Food Allergy, Anaphylaxis, and Connection Team could not be here tonight, but she did pass along a quote that we'll put up on the screen briefly. And I just want to note that, this is another example of one of our food allergy organization collaborators. We work, hand in hand with FACT, and we're so appreciative of support that they give us when we're leading an effort, and we can give them when they're leading one. So just really thankful to also have FACT support on ADDE and many other things. And now, that we're all inspired to take action and use our voices and, build hope, community, and unity, we're going to tell you a little bit about how you can advocate for menu labeling. So right off the bat, if you live in California, we obviously have a call to action. We want you to sign up to meet with your representatives. You can always contact us at afa.org/advocacy team. Ask your restaurants to support the bill. You could write a letter to your local newspaper editor. And of course, AFA is here to support those efforts if you have questions. Again, there's our contact information. But even if you don't live in California, there are ways that you can get involved. Again, you can still contact us, but one of the tools that we have coming up, on the next slide, we are working on a toolkit, an advocacy toolkit for allergen labeling in restaurants. So what this toolkit will provide is some background on the issue. It'll have tips on how to communicate with lawmakers and their staff, a guide on how to find and contact your state legislators, and then some sample letters that you can share with the legislators about your concerns and the policy change that we are trying to make here. So I know we're doing a quick close, but I do want to give Kenny 2 minutes to close us out. And I think we were all very inspired by our panelists, and I want to do one more thank you to all of them. That was wonderful.
Great, thank you, Jenna, and thank you to everyone for taking the time to learn from us and to let us share our perspective on food allergy labeling and the ADDE Act. And I thank the panelists, and I hope we've been able to communicate why this is so important to our community and what our approach has been in co-sponsoring this important legislation in California. Per our vision, we are your trusted ally. And if you found this helpful, I encourage you to engage with us as an advocate on social media or through a donation. As you heard tonight, the work we can do together can be powerful to help our community. It's personal for me, and I know it's personal for all of us who are on this call. Thank you.